go.
Okay, we're going to be going over instruments today. Let's go over retractors first. This is a Goulet retractor, which you usually use above fascia. This is a Richardson retractor. Both of these are different sizes. You usually use these to lift up fascia and retract. You can use them during OB and GYN surgeries, and you use it when you're retracting to make a hysterotomy incision during a C-section. This is a bladder blade. This type we use during a C-section. There's a different kind of bladder blade which kind of looks similar to GYN surgery. These are malleables. They're called malleable because they're malleable, and you can use them as a retractor, but they're generally used to hold bowel down when you close fascia, and they can easily be retained, so be careful. These are straight Mayo scissors, and these are bandage scissors. Straight Mayo scissors are used to cut suture. You can also use them during a hysterectomy, but when you're cutting the uterines. Bandage scissors are used to extend your hysterotomy incision during a C-section. The bottom part is protected so you don't cut anything underneath like the fetus. There's also curved Mayo scissors, which are not, oh, here they are. They're like the same size as straight Mayos, but they're curved, and you use this to cut pedicles like omentum or uterine artery. You can also use them to cut suture, but you should really use your straight scissors for that. These are Metzimum scissors, which are much lighter than Mayo scissors, and they're used to cut usually filmy adhesions and things like the bladder flap and avascular spaces. Next, let's go discuss pickups. These are Adson pickups. They have teeth at the end, and this is used to grab scarpus, fascia, fat, and skin when you're closing. These are rat tooths or pickups with teeth, and they're used to close fascia during a C-section or during a GYN surgery. You can also use Bonnies, which are similar to rat tooths, except they have a little
area for picking up the needle.
Yeah. So those are those pickups of teeth. These are Russians, which you generally use during a C-section. You can use it to grab and close a hysterotomy incision. You can use it to close peritoneum. And they have a little. That's what it looks like inside. Other pickups are the Bakes, which we don't have here, or smooth pickups. Those are what you use in GYN surgeries. These are some other things. These are needle holders. There's different sizes depending on when you need to use them. This is a pool sucker. You can use it to collect suck blood and large pools of fluid, like when you're irrigating. These are ring forceps, which you use to grab the uterus or grab placental tissue. You can also use it as a sponge. Mostly we use these for sponge sticks. You can also use it sometimes to grab the cervix.
You got a minute, go.
To stop bleeding. These are Coker clamps. They have teeth at the end. You use this to grab fascia. They're kind of dangerous, so be careful when you use those. These are called Alices. You can use them to test the skin when you start a C-section. You can use it to grab your angles of your hysterotomy incision. These are Babcock clamps, which we use to grab the tubes. These are Kellys. They're curved. There's different sizes of Kellys. And these are Peons. That's about it. And these are...
Alright.